right, well, welcome everyone. I'm Marcy Hubbs, the leader of the Louisiana Obesity and Diabetes Collaborative, and I hope everyone has been doing well since our last meeting in December. And we're so glad to be able to join you for our first meeting this year. Thank you all for being here. And just a quick glance at today's agenda. I'll start with a few announcements and then we'll receive updates from each of our work groups. And my colleague, Rebecca Guidros, will then introduce our speakers today so we can begin their presentation. So please note that we will reserve time for questions for the speakers at the conclusion of all presentations. So please write down any questions and hold them until the end. Just a few announcements on upcoming trainings and meetings. Well Ahead's Provider Education Network will be hosting speaker Dr. Courtney Walker, PharmD, to present on ROI for Obesity Employee Model on March 31st from 12 to 1. And our Diabetes Echo program is continuing, but you can still join. The Diabetes Echo series provides a team of diabetes specialists, which includes an endocrinologist, a cardiologist, an internal medicine physician, a podiatrist, and certified diabetes educators to review case examples and give care recommendations each meeting. Related to diabetes care topics. And the next session will be April 14th from 12 to 1 p.m. and will be held every other Tuesday for the remainder of the year. The next Oral Health Coalition meeting will be held April 23rd at 10 a.m. I will be including this list with details and registration information in the meeting's follow-up email. So the collaborative work groups have continued to meet to focus on their specific work group goals and have been generating plans to meet these goals. We're so excited about the progress they're making. So I will now let each of the work group chairs provide an update of their latest meetings and work in progress. So let's get started with Kathy with the Access work group.
Yeah, and I think Kathy, maybe see her on, but I think she's kind of got a few things going on now. This is Scott Kirkpatrick and work with Kathy on the Access work group. So unless she's certainly welcome to chime in, but I may take the lead here today. And so we did meet a couple weeks back. And I would say that we are focused on getting some regional sub-teams together as one of the things we're focused on to understand the access issues. We have focused on 3 regions, Region 2 in Baton Rouge, Region 4 in Lafayette, and Region 6 in Alexandria. And on the heels of this meeting, we'll be convening those groups to dig deeper into some of the things I'll highlight today. As we look into access issues, there's several resources that we highlighted as we went through our meeting. One was looking at the community health needs assessments that are required to be done by nonprofit hospitals. And these are just a wealth of knowledge and will be looked at by our subgroups. In particular, I know in Baton Rouge, the Baton Rouge community actually pulls all their hospitals together to provide kind of their community health needs assessments. And so we talked a bit about how those are available, really easily available in most locales, and we'll be looking at that. Also looked at Pennington, the resources they have, and asked our regional work groups to look at those. Also talked about looking at statistics about how diabetes and obesity programs have been successful and or not successful. So I think we're asking our regional work groups to look into some data that show what may be working well and maybe how that may vary amongst regions. I also highlighted the LSU Ag Center resources and the Ochsner Xavier collaboration as different resources that our groups could look at. So again, the sub-teams, subgroups will be getting together after this meeting. We have a lead who will be coordinating that, a lead for each of the 3 regions. And then we'll, shooting for early May, we'll pull the full group together to kind of report out and work on bringing additional information back to y'all. So that's mainly what we did. Certainly, if anybody else who was on that wants to add anything, they're they can go ahead and do so.
All right, thank you, Scott. We'll now move on to Brian Wilson. He's the chair of our Awareness Education Work Group.
Hey, good morning, everyone. Marcy, can you hear me?
I can hear you. Sound great.
Okay, great. Great. Good morning, everyone. So we had a very robust discussion amongst the education and awareness group. And when you put it at its core, we really talked a lot around what is it that the stakeholders need. So when we talk about education and awareness, it's really around the stakeholder engagement and having a clear understanding of where the gaps in knowledge are or where the gaps in need are. So when we met on March 11th, we talked a lot around what that could look like and also tapping into what value that could bring. My co-chair and I, Michael Peoples, we really want to make sure that whatever we bring, that it is of value and that it is relevant with the times. So some ideas that came out of our group, we had a very robust discussion, but some of the immediate ideas were to first set some short, intermediate, and long-term goals. And we had a brainstorming session where we laid a bunch of ideas along the lines. And I'll touch base on a few of those ideas, but I won't go into detail of all of them. But if any of you are interested in the notes from our meeting, we're happy to share them, just in case there's considerable overlap or if there's opportunities to partner with other working groups. So the first was engaging stakeholders at the grassroots approach. So these are efforts surrounding engaging churches, advocacy groups, fraternities and sororities, and other community organizations that really drive home the message for diabetes prevention and also help patients and their families understand the disease process. We also talked a lot around Project Echo and thinking about where we can tap into that network of providers because they play a pivotal role in using specialists to assist those in the community with regards to understanding difficult patient populations and difficult disease cases. So that was some discussion around that. We also talked a little bit around some efforts to not forget the youth population because in Louisiana, as well as in our neighboring state of Mississippi, there's a huge need for diabetes prevention, awareness, and education in adolescents. So we talked a little bit around that. And I want to give a shout out to one of our working group members, Logan Poole. He's very interested in this topic and provided us with some resources that I believe could set the basis of some really interesting areas we can explore. And then lastly, we heard, and I want to give another shout out from another working group member, Cherie Joseph, who talked about this idea of engaging the community by leveraging technology. So a lot of the payers, the CMS systems, they have databases where they actually have phone numbers and emails for different individuals, different patients that are enrolled across their programs. And one idea we thought about was trying to tap into that a little bit to see if we could, in a very compliant way, sort of survey those individuals to understand what their needs are, what is their base level as it relates to diabetes, education, and awareness, and then ask a subsequent through surveying around, well, what are the gaps? What are the areas that you feel you need more understanding on? And we feel utilizing these approaches will allow us to tailor more laser-focused approaches. And again, our group is focused on not just giving information, but we want the information to be relevant. We want it to be timely as well. So at the conclusion of that meeting, we collated a robust number of ideas. We certainly have a number of those that we can start to work on right now. And if, like I said before, if any of you are interested in seeing the notes from our meeting, we're happy to share those. And I'll pause for a second to see if my co-chair, Michael Peoples, would like to add anything additional.
No, Brian, that definitely covers it. And, in terms of what we talked about, and I think just even leveraging what's available out there right now, like now's the time, la.com, as well as Well Ahead, just getting those types of resources out to the community and to people who drive education, like you said, the churches. And there's so many avenues to tie into already what's existing to drive education and communication to patients. Not just, I think, Brian, you and I talked about this, not just diabetes and obesity, but even pre-diabetes, getting the word out there, telling patients, hey, what can I do? And it's just sometimes just easy steps, whether it be around nutrition or changing lifestyle. So just leveraging what's available and making sure we make the connections and getting the word out, and not just, in certain areas, but see, how can we impact the majority of the population in Louisiana? So well said, Brian. Thanks. And that's all I have to add. Hope everyone has a great weekend.
Thank you, Brian and Mike.
Thank you. Thank you.
Thanks. All right, now we'll have Dr. Amanda Sayano present the payer policy work group updates on behalf of Bonnie Email, the chairperson for that work group.
Yeah, thank you, Mercy. So Bonnie sent me a long list of updates that I'm going to summarize for you. And I will say a few of these have either websites or other information. So I don't know if we have chat function or if I should just make sure, Marcy, you have it over email.
Yeah, you can send it to me and I can include it in all the follow-up notes for the meeting.
Perfect. Okay, so I'll do that. So I'll just give y'all kind of the highlights. So one of our members, Dr. Katie Queen, who's a pediatrician with Our Lady of Angels, which, and affiliated with Our Lady of the Lake, has done quite a lot of work in recent months, particularly on pediatric obesity. So she did want to share that tomorrow there's a virtual educational symposium hosted by Our Lady of the Lake on pediatric obesity. It does run all day. Again, you can just go online to view it. And then there will be recordings afterwards too for people who want to participate. It's mostly geared towards pediatricians, dietitians, social workers, people in the healthcare community. But it's a really nice synergy between Pennington and the healthcare community, I think, to describe, the evidence-based approaches to pediatric obesity and what's available throughout the state. So I will be sure to send Marcy the info on that if you're interested. Next up, Katie has spearheaded a survey of health plans in the state of Louisiana for obesity coverage, both for adult and child obesity. And hearing the other work groups present, I think there's quite a lot of synergy between, what we're all doing. So hopefully this information can help you in your work too. Now, Katie has been, trying to get responses from all the major health plans. We've only gotten one from Humana. And so we do have details on their coverage for adult and child obesity. And we also have information from Louisiana Healthcare Connections on their bariatric surgery policy. But we are trying to get information from the other health plans too. So that could be something if anyone on this call or throughout the whole group has connections, or I know we even have representatives from the health plans. I think Katie and Bonnie and I would love to talk just to figure out, what would it take to try to get some of this information so that we can collate it and ultimately inform providers and patients about this coverage. And so on that note, Katie has created a billing coding reference guide. And that's what she's trying to do, is create a living document that providers and families and patients can access so that they can look up their particular health plan and understand what's available to them and versus what they would have to pay for out of pocket. So we do need some volunteers. So I encourage you each, if you have connections to health plans, please let Bonnie know so that we can pursue that. Katie also wanted to share that liraglutide was just FDA approved as a weight loss medication for adolescents ages 12 and over just a few months ago. So we do have information on that. And Katie is working to get this on the Louisiana Medicaid formulary as a weight loss indication for obesity. And a formal request has been made to the Louisiana Department of Health. We would love to have somebody lead this charge. So if you know of anybody who would like to work with the State Department of Health to make sure that that medication gets on the formulary, I think this could really be a game changer for a lot of adolescents throughout the state. So we'd love to have someone help on that initiative. Also, similar to the prior points, there is going to be a study resolution for pediatric obesity in Louisiana, excuse me. And the Louisiana American Academy of Pediatrics, Louisiana chapter, is working on this, the Pediatric and Obesity Committee of that group. And lobbyist Stephen Wright has been hired to assist in this initiative. And so what the study resolution will be is to survey the current insurance coverage. And so this would actually then become mandated that the insurance companies have to report on their coverage for adult and child obesity, and also to survey the state nutrition and physical activity requirements in Louisiana public schools through the Department of Education. That's something that this group has done several years ago, but it hasn't been updated in quite some time. So we think both of these initiatives could really help to expand access and to both prevention and treatment of obesity. Again, if you're interested, we left more manpower and woman power behind these initiatives. So please reach out to Bonnie to volunteer. And then the final are just a few quick updates. The Senate Select Committee on Women and Children met a few weeks ago at Pennington and made a presentation on obesity prevention and treatment across the lifespan. And so that video is available online on the Senate's website, and we'll send the link if you're interested in seeing this. There are CDC resource information flyers available regarding links between obesity, overweight, and COVID-19, specifically on the higher risk for hospitalizations and death and other serious illness caused by the disease. And so these are very easy to download and distribute if you have groups who need that information. Similarly, we know that the governor expanded eligibility for the vaccine to any adult who has a BMI of over 25. And so this really has increased access to the COVID-19 vaccine, and I think elevated the need to consider overweight and obesity and its health implications as it relates to viruses and infections. And then Bonnie wanted to share that Senator Barrow is again authoring legislation regarding the Louisiana Office of Group Benefits coverage for bariatric surgery. So they have been involved in this for many years now. And so if you're interested in helping with the legislation, you're welcome to reach out directly to Senator Barrow. And then finally, Bonnie wanted to share that if you're aware of any legislation that might be of interest to this group related to obesity and diabetes, please alert Bonnie email of this legislation so that she can have it on her radar and can help to advocate for it. So again, I know that was a lot of information, but Bonnie's been quite busy, as has the work group, and I'd be happy to send y'all more information via Marcy.
Thank you so much, Dr. Staiano. And those are great updates from all of the work groups. And thank you all of our work group chairs, co-chairs, and members for all your dedication and hard work to improve diabetes and and obesity health outcomes for our state. You really are making a difference. So big thank you. All right, and the email addresses are here. So if you do find that you have overlapping work or resources or anything that could benefit another work group, you can reach out to the chair listed here. All right, well, March is National Nutrition Month. It's an annual campaign created by the Academy of Nutrition and Dietetics. And so the campaign promotes informed food choices and developing healthy eating habits in coordination with National Nutrition Month. This meeting will focus on addressing health disparities through community nutrition and lifestyle programs. So today we're joined by 3 speakers that will highlight activities, programs, and resources centered on food access, healthy eating, and behavior changes. So Rebecca will now introduce our speakers for today.
Thank you, Marcy. So we are very excited to have with us today some wonderful folks who are committed to moving Louisiana forward. Today's meeting features Ms. Kira Davison, Ms. Jordan Ring, and Ms. Helen Hu. I'm pleased to be working with all 3 of these ladies on the National Diabetes Prevention Program, which will be briefly mentioned in their presentations, in addition to so many other services and resources that they offer to the communities through their organizations. So Kira Davison is a licensed and registered dietitian nutritionist. She serves the Rapides Foundation as the CMAP Healthy Lifestyle Program Coordinator. She's responsible for promoting the program through physicians and assisting clients to lead healthy lifestyles through development of individualized nutritional interventions. She holds a Bachelor of Science from Nicholls State University, and she completed her dietetic internship at Tulane University. Jordan Ring is the Associate Director of MLK Health Center and Pharmacy in Shreveport. She spent the last 3 years leading the center's public relations and community engagement efforts. With a media background, her transition to MLK Health has allowed her skills and passions for her service to collide. She recently became a certified DPP lifestyle coach and cannot wait to step out from behind the computer screen and begin working directly with clients. And Helen also is a registered dietitian nutritionist and serves currently as the Community Health Program Manager with Sankofa Community Development Corporation in New Orleans, where she oversees food access and nutrition education programs. Her passion for nutrition extends into increasing access to nutritional foods for families, to educate individuals and families about healthy eating, and to increase nutrition literacy. Prior to Sankofa, Helen was the dietitian for the Head Start program in Jefferson Parish. She has also earned her master's in clinical nutrition and dietetics from New York University and completed her dietetic internship at Tulane University. So Kira, now you can begin when you're ready.
Thank you, Rebecca, for that. I will just go ahead and get started. So my name is Kira Davidson, and I'm the lead coordinator for the Healthy Lifestyle program here at the Rapides Foundation. And I'm definitely proud of our program. We're in our 9th year of implementation. So some of our objectives today is just to discuss how the Healthy Lifestyle program is implemented to meet the nutritional needs of Central Louisiana residents, and also to share how we are getting ready to launch the National Diabetes Prevention Program, how we're using that Healthy Lifestyle program to do that as well. The Healthy Lifestyle program got started in 2011 as a strategic component of the Rapides Foundation's Healthy Behaviors Initiative. And we are a program of CMAP. We're administered by CMAP, which is an affiliate organization of the Rapides Foundation, and we're funded by the Rapides Foundation as well. Our goal for Healthy Lifestyle program has always been to be a wellness resource for Central Louisiana physicians, and also to be to provide access to to nutritional and physical activity resources to our residents. It's just really to promote ways to lead healthy lifestyles and give them those tools to do that. So the program is a evidence-based lifestyle change program. And again, we're in our 9th year of implementation. The program is completely free. We do not bill insurance. So there are some qualifications. It is led by registered dietitian nutritionist and certified exercise specialist. And participants are learning ways to lead healthy lifestyles through behavior modification, through diet and exercise. The qualifications are very simple. They have to have a physician referral. They need to be within our service area of the Rapides Foundation. And the physician referral usually comes with things that the physician may feel that the dietitians need to know and better help their patients as well and stay on board with their treatment plans. But usually those things are progress notes, labs, things like that. Anyone over the age of 5 can be in our program. So we do see children, adolescents, as well as teens. Clients are strongly suggested and encouraged to make a 6-month commitment to the program. And like I said, it's completely free as long as they're over the age of 5 and there's a physician referral and they're in our service area. This is our referral form. The referral is very simple. Ideally, the patient is in the physician's office talking about some lifestyle changes that need to be made, weight loss, diabetes education, management, pre-diabetes, whatever the case is. And so the doctor then is able to refer them to us and send this on to us as well. And our office then contacts them, the patient, and schedules them with the dietitian. So the program structure, it's a 6-month-based program with biweekly appointments throughout the 6 months. Ideally, they have 12 visits. But sometimes, depending on the participant or the client, that that program may look a little different. So initial session is with a dietitian for getting them started with some proper nutrition education, laying some groundwork for my plate guidelines, just kind of basic information, and then go from there through to tailor their nutrition plan. The 3-month evaluation and the 6-month evaluation is also with the dietitians. And in the meantime, the other sessions are with the exercise specialist, and she also serves as their health coach as well. They'll be reviewing food and fitness logs, assisting them with goal setting, and doing regular weigh-ins as well. So we know that long-term healthy lifestyle change is where we see more benefits, and they stick with it longer. So we also started offering a maintenance phase of the program. So for those who are compliant with program guidelines, they are offered an additional 6 months, and we tailor that to a once-a-month session instead. The participants throughout the program are getting tailored nutrition and behavior change counseling. They're getting meal planning, exercise plans based on their needs, and they are the main goal. Really, we did not really realize how many people just don't know basic nutrition. So we really hit my plate guidelines pretty hard, and again then tailor that if their nutritional needs need that. But and then we try to get them to reach 150 minutes a week of physical activity. They're getting tools and incentives throughout the program, like I said, food and fitness diaries, whether that be on our logs that we provide them, or they can use apps. We come out with a Get Healthy Sinlaw Challenge calendar every month. So our team gets together and provides nutrition tips, exercise plans for the month, and this is given to our clients, and it's also available for free for download on the Rapides Foundation's website. They're given portion control plates, measuring cups, as needed, new recipes, grocery shopping lists. Lydia, our exercise specialist, works with them on workout plans and provides exercise bands, and the kids get jump ropes. The benefits that they're getting by one-on-one counseling and just the intervention is they're learning ways to eat well, learning how to balance meals, how to prepare healthier meals for themselves, but also for their families. If a kid comes in, a child, adolescent, teen, the focus is on them, but it's highly also focused on the family and how they're going to be changing their behaviors and supporting the child and all that. They're learning ways to be frugal and cost effective in their shopping for their groceries. They're learning how to move even when they have limitations and disabilities. They are learning ways to be mindful in their eating and how to deal with their food cravings, and just overall just be more aware of their eating habits and their health. We provide online resources through several different ways. The RapidsFoundation.org website has recipes, videos. Our YouTube page has eating tips, exercise demos from our team, and their calendars, like I said, are always available for download. And our private Facebook group is for those who come into our program, and that serves as an online support group for those. The clients that come through our program, we provide them with a pre-assessment survey, a midpoint assessment at 3 months, and then at 6 months their completion survey. And it focuses on behavior changes and improvements So we go through that with them, and these are just some results that they are reporting. We see some weight loss. We're not a weight loss program, but we do weigh-ins and all that good stuff. But so we see weight loss. We see improvements to their blood pressure, cholesterol, sugars that they're reporting. Their medications are changing or being modified. They are reporting reduced pain overall, whether it's knee, back, shoulder. There's always someone saying their specific pain to them. Healthy eating is better. Overall wellness, GI issues are improved. So things that we all know are improvements as their nutrition and exercise are improving as well. The Rapides Foundation service area is composed of 9 parishes, and we still feel that there is a need for this service that we provide. We surveyed several of the entities in the area to see what services are provided that are similar to ours, just making sure that we are meeting that need. And there really is not a service that is currently offered specifically for counseling that's customized to an individual, and nor is it free. The need for behavior change, like we said, is still at a high with the incidence of obesity, diabetes, pre-diabetes, and the health spectrum, is wide. So there is a need, and we serve the 2018 health needs assessment from the Rapides Foundation. They put that out again in 2018, and they asked several. You can move the slide, Marcy. Sorry. They asked several community leaders in the areas on what were some needs or some concerns, and the leaders of the community show that there or report that there's a need for education. I think that's why we're all here. Education, prevention, availability for facilities and programs to help with provide proper nutrition and physical activity education. So the outcome measures that we measure are number of clients receiving one-on-one counseling, number of physicians being referring to our program, total inches lost and pounds lost, and that's really on an individual basis, just so that the patient and us can see, the changes being made. Percentage of participants who complete our program, and the percentage of those that are compliant with program guidelines throughout their completion. And then there's also those who report, what's the percentage of those reporting that they have a better understanding of daily nutrition and exercise requirements on those pre and post surveys. So throughout, with that program being implemented, we know that there is a need for diabetes prevention, and pre-diabetes as well. Most people don't understand or realize that they have pre-diabetes when they are in our program. And so we have been doing a lot of education on that over the years. And we really would like to increase our reach in our area. And this would be a group-based program. And so using similar things that the Healthy Lifestyle Program offers, we feel this is going to be a really good addition to our program, and we are excited to get started. We've just finished training all of our Healthy Lifestyle Program staff for lifestyle coaches, and our first cohort, we are looking to start that in April of this year. And so the strategies are going to be for the Prevent T2, it's a CDC curriculum that we'll be using. The goals are for the year-long program are moderate changes to both diet and physical activity. We'll be focused on modest weight loss. So this is going to be weight loss driven versus our healthy lifestyle program is not necessarily weight loss driven, just education and healthy eating and physical activity promotion and guidance there. This one will be weight loss driven alongside, moderate changes to diet and exercise. So we'll be focused on supporting the individual, building self-efficacy, social support from the group, and as well as problem-solving strategies to overcome those common barriers and challenges to weight loss. So CMAP Express is our organization, and it is a 501c nonprofit. We offer definitely a few different types of programs for free to our communities. The mission for CMAP has always been to ensure that limited income residents have appropriate access to medication and health education, and encouraging preventative practices in our service area. And so this is how a healthy lifestyle program came in to fit this, this mission. The CMAP program offers free and reduced cost prescriptions to eligible clients. The program functions as a central fill pharmacy, not as a retail pharmacy, but a distribution center for donated products. And once the medications are mailed to the physician's offices, they're then distributed to their patients. And CMAP offers a variety of things, programs. So Cancer Screening Project offers free breast, cervical, and colon cancer screenings. The Smoking Cessation Project provides free medications, group and individual counseling, and a quit line for smoking. And its partnership is with the Smoking Cessation Trust. And then the Community Health Advisor goes out into the community for outreach activities to build awareness of cancer screening and the importance of early detection, and also helps those individuals with resources for early detection. And they also promote all of our CMAP programs. And that's it in a nutshell. Thank you so much.
Thanks, Kira. Appreciate it. And you also received 2 questions already in the Q&A box, which we will address those at the end of the presentation. So next, I just want to introduce Jordan Ring again with MLK Health Center and Pharmacy.
All right. Well, thank you so much for having me today. I'm really excited to talk about the work that we do in Northwest Louisiana. As Marcy and Rebecca said, my name is Jordan, and I am the Associate Director of the MLK Health Center and Pharmacy. Can we switch to the next slide? So we are the oldest free clinic and free pharmacy in Northwest Louisiana. We're actually the oldest free pharmacy in the state. And it's our mission to provide comprehensive primary care to uninsured and underinsured adults who struggle with chronic conditions. We truly are a free center. Everything that we provide to our patients is at no cost to them. We were founded in 1986 by Dr. Robert Jackson. At that time, he was the chief resident of internal medicine at LSU Med School here in Shreveport. And he was doing his ER rotation as part of his residency program. And in the ER, he saw 2 main problems that really struck him. One, there was a population of patients who were using the emergency room as their primary care provider. And then secondly, there were a group of people who were coming in and out of the emergency room with catastrophic complications from manageable diseases. So there were hypertension patients who were coming in with strokes and heart attacks. There were diabetics coming in having to have limbs amputated because their diabetes was unmanaged. And this just did not make sense to him. So he starts asking questions, and this revealed a unique population that we continue to serve today. Can we hop to the next slide, please? So the patients that we serve at MLK Health are uninsured and underinsured adults. So we do serve exclusively adults. We're privately funded, so we have very finite resources. And we found that most children through the LA CHIP program will qualify for Medicaid even if their parents don't. And the way that we define uninsured are household incomes that fall at about 300% of the federal poverty line. And those are those households that we know that adults are not going to qualify for Medicaid, but that's not nearly enough to afford private insurance, and their employers are not offering employee-based plans. Underinsured adults are going to be those people who their out-of-pocket expense is about 10% of their annual income. So if we have a patient that makes $35,000 a year, they're paying out of pocket $3,500. And the way that that's really playing out for our patient population are going to be your Medicare patients who are lacking Part D. So they do have their own primary care provider, but they can't afford their medications. And so we provide that service to them. And we work with long-term chronic care patients. So our patients come to us pre-diagnosed. We're not a drop-in clinic. I have the flu or bronchitis. We work with adults who have diabetes, asthma, hypertension, COPD, respiratory and cardiac issues. And the reason why we do this is because we want to improve the health of chronic disease patients, provide care for patients with no payer source. We want to reduce the return visits to the ER and to the hospital because we know that those are not proper functions to manage chronic conditions. And if we can do that well, we're going to help reduce healthcare costs to the community. And really, the underlying reason that we do all of this is because we want to keep people healthy and productive. Can we go to the next slide, please? And so the way that we provide this comprehensive primary care is that we operate using the person-centered primary care model that takes into consideration the whole patient. And we are a one-stop shop for our patients. So when our patients come for their appointment, they get to see a primary care provider. All of our physicians volunteer their time, and our provider team is made up of physicians and nurse practitioners. They're going to get nutrition and wellness consults during that appointment. We have a lab on site, so they're going to get all of their blood drawn during that first appointment. We have a pharmacy on site, so they leave with all of their medications. We can do STD and HIV testing during that appointment. For our women who are eligible, we do a women's clinic twice a month, and that's when women can come and get their annual well woman exam and their mammogram on site. We don't have a mammography wing of our clinic, but we do partner with a local organization that brings a mammography van, because it's really important to us that all of the services we provide under one roof in that one visit, because we found that our patients either lack PTO to go to a doctor's appointment, they lack transportation, and we found that if we're trying to send them to multiple locations to get their care, at some point they're going to stop steps in the process, either because they can't get off work or they just physically can't get there. We also have a care coordinator on site, so she helps reduce other barriers that our patients face. So they come to us for their healthcare needs, but they might have limited transportation, as I mentioned. They might struggle with food insecurity. She can help them coordinate with other local nonprofits to make sure that they're getting all of their needs met. One thing I didn't mention is we don't charge any insurance. We don't seek reimbursement. If our patients are eligible for Medicaid, they're not eligible for our program, but we can help them apply for Medicaid. And if they become eligible, our care coordinator will help them find a Medicaid provider. And then she tracks them for 6 months to make sure that the provider is a good fit and that they are making their appointments, because we would hate to have, say, a diabetic in our care for 4 years, and then they become Medicare eligible and they leave our program and they get placed with a provider that's just not a good fit. And because of that, they discontinue their care, and then they've been 6 months without going to the doctor or getting their medication, and their A1C is now off the chart. So it's really important to us that when our patients leave our program, that we make sure that they find a health home that works for them. And then we have the Building a Better Recipe for Life wellness program that I'm going to dive into in a few more slides. But let's go ahead. Oh, I'm sorry. Before we start, that was my fault. May we go back real quick? One thing I didn't mention is that all of our services are provided in Spanish and English, and we do offer evening and weekend clinics. So it's really important to us that we provide care to our patients when they need it. And we have, like I said, a lot of patients that just cannot take off time for work. And so they have our Saturday clinics or our evening clinics. So it's really important that, like I said, we're creating access when patients need it and not just when it's convenient for us. And because of this model, about 96% of our patients have reduced return visits to the emergency room. So we're very proud of that. I'm sorry, now we can go to the next slide. So this just kind of gives you a flavor of some of the people that make MLK possible. We really do rely on the support of volunteers, whether it's the physicians, the nurse practitioners, medical students, pharmacists. We have a number of specialists who come on a quarterly basis. We have a nephrologist, an endocrinologist, a dermatologist, a joint injection specialist, a breast specialist, and then a urologist. Again, trying to provide that wraparound care when we can. Next slide, please. So this is our wellness program, and this is really why we're here today, right? These are our programs designed to prevent diabetes, to teach people to live well with their diabetes, and to help build healthy lifestyles. So Be Aware is our health and risk assessment teams that we've created. And in a non-COVID world, we were very active in health fairs, worksite wellness at businesses. And it was really important to us that when we're out in the community trying to make people aware of their health numbers, that we had a team of people that could not only just do point of care testing that could produce results in real time, but that we had people there that could actually sit down with the clients and explain what those health numbers meant. So they got their A1C, that's great, what does it mean? And if there was a problem, if they had an elevated A1C, elevated blood pressure, that there would be time within that experience for them to build a plan that they could start making healthy lifestyle choices. So it's really important to us that our patients, or the clients in the community, if they're getting services from us, they know what their health numbers are. They know what those health numbers mean. And if there's an issue, they walk away with a plan, they walk away empowered. We also offer the diabetes prevention program, and Kira did a great job in her presentation kind of walking you through what that program is. But this is a program that we offer for free and is open to the community. So regardless of insurance status, if there are members in our community that are pre-diabetic, they are eligible to participate in this program. And it is a 12-month program, which we just kicked off at the beginning of this month. So we're really excited. We have a great group of participants who are very encouraged and very excited to make lifestyle changes. Living Well with Diabetes, that encompasses the diabetes self-management education class. And again, that is a program that's open to the community. So if there are diabetics who have their own primary care provider, but are just needing additional education about how to make lifestyle changes, how to take the medicine properly, this is a program that we offer to them. I'm gonna come back to Eat Well and the fresh and fast healthy eating, but we do have a program called Get Moving. Through grants and other partnerships, we're able to build a little gym within our clinic. So during appointment times, again, in a non-COVID world, because of the comorbidity of our patients, we've had to shift our model a little bit. But when we were able to do group education, we had instructors come in that would do exercise classes during the clinic that were low impact, designed to just teach our patients how they can get moving from the comfort of their home. Or we expanded that program to have twice a month outside of clinic. It was just open to the public. If people wanted low impact exercise, a guided routine that they could come, we offer that to just the community at large. And we do offer ongoing health coaching for our patients, just to make sure that if they're facing any challenges in their lifestyle changes, that they do have that place within our clinic where they can modify their plan with a health coach. And now I want to jump back to the Eat Well and then the fresh and fast healthy eating. And that's a program that really depends on our community garden that we have on site. It's the MLK Learning Center. And we believe that food is medicine. So what our patients are putting in their body is going to affect their health outcomes. And we could give them handouts and pamphlets that say, eat this, don't eat that. But we found that if we really want to change behaviors, we have to teach our patients how to eat healthy. And so through these two programs, we've partnered with local chefs across our community that, again, in a non-COVID world, would actually come in on clinic days and do healthy demonstrations in the waiting room. And those chefs build recipes based on what's growing in our community garden, and our garden produces year-round, to teach our patients, A, how to eat seasonally, and then B, to show them that healthy recipes can take 5 minutes and 3 ingredients. And it's really about how the dishes are prepared. So they get to taste it. And if they like the recipe, then we take them out to the garden and they get to harvest those ingredients to take home with them, because we found that a big barrier for our patients. It's just that they're limited income, right? So they go into the grocery store with $20 for their budget for that day, and they've got 3 kids to feed. Well, they're going to keep going to the frozen food section because they know their kids are going to eat their chicken nuggets and they just want to keep their kids fed. So if we can take the financial risk out of experimenting with healthy dishes, we found that our patients are more likely to change their behavior. If we could look to the next slide, please. And so this is the MLK Garden Learning Center. I realized that this picture was a little pixelated, and when it was time to turn in our slides, we had just gotten through the Arctic blast, and so our garden was pretty devastated. But you can see, based on the size of our garden, that we're not treating food insecurity. We're not here to feed hungry people. It really is a teaching laboratory. We have 5 raised beds that go around the pavilion that produce year round, and we really focus on shareables, things that to build a recipe, they only need a couple of the fruits or vegetables. Within this garden, like I said, we do cooking demonstrations that are based on what's growing in the garden. In 2018, 2019, we did 37 cooking demos with 540 participants. And the chefs prepare demos based on the garden crops. And we produce about 6 to 10, or we plant 6 to 10 different fruits and vegetables every season, which comes out to about 24 to 40 plants annually. We have 7 different fruits that grow. We did a survey of our patients to figure out, what they lacked the most access to, and overwhelmingly our patients said that they lacked access to fresh fruit. So that's why we really put an emphasis on planting fruit trees. We partner with an organization called Shreveport Green, and they work in food deserts, and they have a mobile market. And a lot of our patients are clients in those food deserts, but they'll actually bring their mobile market to the garden on clinic day. And we purchase vouchers from Shreveport Green for our patients so they get to go shopping. And they're also doing cooking demonstrations during their mobile market. So we can slip over to the next slide, just kind of give you a flavor of what goes on in our garden. So on the left, you see we have a lot of peppers that produce during the summer, and our patients love to go out there with their shopping bags and just pick peppers. On the right, we have Swiss chard. That is a produce that is a new produce for a lot of our patients. But we had Chef Melissa Brannon come in, and she did this cooking demo that was Swiss chard, red wine vinegar, garlic, and onions, and it was the most amazing dish we'd ever had. And so our patients were a lot more excited to go out there and harvest some of the chard. You go to the next slide. Ooh, there we go. Well, we do have familiar produce like the collard greens. On the right, you see Shreveport Green. So their baskets of totes are filled with fruits and vegetables that are gifted to them from local farmers that just have a surplus. And you can see the Shreveport Green team member doing a cooking demonstration. So it's really fun to watch the patients go out there and try the samples, and then they get to direct them to the ingredients from that recipe. The next slide, please. So again, just a little bit more. We've got lots of peppers. That's an exercise class that's taking place out in the garden on a sunny day. And then this picture on the right, those are flowers. And I think I just wanted to make it a point to say that it's really important to us that we have created a garden that is also a beautiful space for our patients, because we know that overall wellness doesn't exist apart from our physical spaces. And we wanted to have a garden that people wanted to come, that they wanted to sit and participate in the education that was going on. And that's just one clip. The entire perimeter of the garden is nothing but just aesthetic flowers. So it's really important to us that the spaces that we're building for these wellness programs are beautiful spaces that people look forward to coming and participating in. And thank you guys so much. This is my contact information. If you have any questions, I know we're questions at the end, but feel free to reach out to me directly. Thank you so much.
Thank you, Jordan. Appreciate you sharing all that information. So many different great resources and programs that y'all have in Shreveport. So we will now hand it over to Helen with Sankofa Community Development Corporation.
Hi, good morning. I'm so jealous. I want a garden like that. Anyway, yes, so I'm Helen. I am the Community Health Programs Manager at Sankofa, and we're located in the lower 9th Ward of New Orleans. And our motto and our mission is to build healthier communities for generations to come. Okay, next slide. So what we're going to learn about today about Sankofa, we're going to learn about Sankofa and the programs that I manage, but we're also going to learn a little bit about the food landscape and the demographics of the Lower Ninth Ward. I'm going to talk about some of our partnerships and collaborations and talk a little bit about our wetland park and garden. So Sankofa is sort of an all-encompassing organization that works on community health, but it's also working on sort of environmental health. We're trying to rebuild the community landscape as well. So the Lower Ninth Ward, in case you didn't know where we are, we're just this little corner in New Orleans, and I'm gonna focus just in our little census tract area there. I'm a little bit of a data nerd, so I've got a lot of like census information. But in terms of our food landscape, in the Ninth Ward, we have about maybe a dozen food stores in our specific neighborhood. And within a mile, there's another dozen odd food stores across the canal to our left, and also in St. Bernard Parish to our right. Next slide. So in terms of actual grocery, like supermarkets, though, none of them are located within the Lower Ninth Ward. So you could sort of see in the lower right where the Lower Ninth is located. The nearest full service supermarket is a mile away. The Walmarts are 3 miles, 4 miles away, and then there's a Dollar General market. So we are technically a food desert because we don't have a full service supermarket within a mile of our location. Okay. So in terms of the types of retailers we have just within the Ninth Ward and within a mile, as I mentioned earlier, we don't have any full service supermarkets, and that's defined based on their sales and the number of departments they have, the kinds of departments they have in the store. But we have some grocery stores, but we mostly have convenience stores, gas stations, corner stores, stuff like that. About half of the stores in our neighborhood accept SNAP, but very few of them accept WIC. And that's, because with WIC, there's lots of requirements on what you need to have in the store, what needs to be stocked. And these little corner stores just don't have the capacity to maintain a WIC program. Next slide. So last summer, we did a survey of these stores to find out what food accessibility and affordability was like, and availability. If I were to go to a corner store, could I get a bag of beans? Could I get a bag of brown rice, etc.? So to understand this table, we have the nutritious options listed on the left. The first column that says none indicates the number of stores that didn't sell any of that product. So every store sold milk, for example, so there's no stores that didn't sell milk. And in the middle column, it shows how many options of that product they had. So 12 stores had one kind of milk option, and 8 stores had 2 or more milk options. So that's kind of how the rundown is. Like, there's some items that are easily available at stores, like say dried beans, but some other items like frozen fruits and vegetables aren't as easily available at the stores within that mile of this neighborhood. So availability is limited and it varies based on the item. Next slide. In terms of affordability, we also compared the cost of buying these items within the mile of this neighborhood versus Canseco's, which is the nearest grocery store to us, supermarket. It's a small family-run supermarket, and then compared to the Walmart. So it was really sort of hard to compare the local small grocery stores like apples and oranges because the availability of some items just weren't there, or they were sold in different packaging ways, like per apple versus per pound. So, the Chicken Mart, you can kind of go across the board and see how much it costs for a pound of, bananas or a can of tuna. Some things were not so bad. Other things were way more expensive. And when you compare Canseco's, the nearest supermarket, to the Walmart, it's 50% higher costs to shop at the Canseco's. So if you can get to the Walmart, that's great. You'll save money. Next slide. So as I said, if you can get to the Walmart, you can save some money. But here in the Lower Ninth Ward, we have about 25% of residents don't have access to a vehicle. So that in and of itself is a problem. You got to find a ride, you got to take a bus. And there are stories of people who will take 2 buses to get to a Walmart, and it takes them about an hour. The Walmart that is closest to us, we can't actually get a bus there. If the bus goes about 2 miles out, you can get to the Canseco's ish, and then the last mile you'd have to walk. So access to food is one of our biggest issues. Just not having a full service grocery store within walking distance or within a single bus ride. So that's one of our biggest challenges. Next slide. In terms of wealth, the demographic landscape of this area, and I did a comparison with the rest of Orleans Parish. You could see, compared to the rest of the parish, our median income is about 25% lower than the rest of the parish. The percentage of people living in poverty is almost doubled, and the number of people on SNAP is twice as many as the rest of the parish. Next slide. In terms of health, again, comparing it to Orleans Parish, the residents of the lower ninth have higher rates of all these chronic diseases, obesity, diabetes, kidney disease, you name it. Our percentages are higher, and our life expectancy just in the lower ninth ward area is about 5 years less than the rest of the parish. So we've got a perfect storm, I guess, for lack of a better expression, of health disparities, wealth disparities, low access to affordable foods, low transportation access. So next slide. This is where Sankofa comes in. We're located in the lower ninth ward, and as the community health programs manager, I oversee the food access program. So we run a food pantry here. We're a partner agency with Second Harvest Food Bank, and you can see some of the things that we're able to provide these families. Fresh fruits and vegetables, proteins, eggs, peanut butter, things like that, some whole grain stuff. Our pantry is open twice a week. We also do delivery once a week to the homebound or folks who don't have access to a vehicle or someone who could pick up on their behalf. I can tell you that before COVID started, we were only open once a week. And then when it was super busy, we were open 5 days a week and delivering twice a week. And we've kind of got to like a more steady pace that's just not quite as frantic as when COVID broke out. Next slide. So here we have a graph just to show you how many families we've been serving and just kind of how it's changed from, like, on the far left of the graph. We're at about, I think, 140 households. We had a little dip in February, but then it spikes up in March when COVID broke out. And we've been at this high level, serving about 400 households per month. Clients are eligible if they are Louisiana residents and meet income guidelines. So I think they have to be, I think it's 130% of the federal poverty guidelines. Pantry clients can come once a month to pick up a box. We have some standards here, so we're not just giving out anything to, access is an issue, but I want to ensure as an RD that they're getting access to fresh, nutritious foods, to wholesome foods. So, I'm very selective in what we choose. So making sure that the items are low in fat, sugar, salt, that they're high in fiber, because we have a lot of residents with chronic diseases. So I want to make sure that they're getting wholesome foods and we're not giving them something that's going to exacerbate their conditions. Next slide. Okay, so another program that we do here is we partner with Catholic Charities to provide the senior commodity box. So those are for folks over the age of 60 who meet those same income guidelines. And it's a pre-packed box of dry goods that Catholic Charities provides. We go pick them up. We have this wonderful volunteer who picks them up for us and delivers them to the seniors, again, who have no transportation or who are homebound. And we also distribute them from our center during pantry days. Next. And something that we started last year with COVID, we started doing summer feeding and after school at-risk programs. And it's again, another way to get freshly made foods to the kids, when they were out of school because of COVID and throughout the summer. So it's pre-packed meals that we do through a partnership with the Healthy School Food Collaborative and Revolution Foods. And these foods meet USDA nutrition requirements for their summer and after school programs. All right. So that's the summer program. We just started a new snack program at Sankofa. Oh, just back up one slide. There we go. So we got a grant from No Kid Hungry to provide nutritious snacks to the kids. So we pack in a bag, like 10 items that families can pick up once a week and bring home to their kids. And this was in response to if, kids were at home, or even if they were attending school, we wanted to introduce the idea of nutritious snacking, and try to change some behaviors about snacking, because we know that the snack foods that are available at the local stores, the corner stores and gas stations aren't the most nutritious. So with the snack pack, it comes with fresh fruits and some vegetables, some whole grains, proteins like string cheese, yogurt, peanut butter. And I included with it educational flyers to explain what the program is. I do a spotlight on different kinds of items. So I might do a spotlight on dairy and why that's in there and why it's important, or a spotlight on peanut butter, for example, how to eat your peanut butter with a banana or slices of apples, things like that, to give kids ideas and new ways of eating these foods. And with this program, I'm doing surveys to find out what snacking habits are, what the kids like, what they didn't like, and if any snacking habits have changed through the program. So we started that at the end of January, and we are about halfway through. So I'm starting to get some mid-program surveys back, and it seems to be going pretty well. The kids seem to like the foods. The parents especially like having the dairy in the packs. One of them said it was a game changer, and it was major to have dairy in the pack. So I'm like, okay, great. Yay, yogurt and string cheese. So we'll see at the end of the program, what habits and shopping habits have changed. Next slide. Okay, so another thing that we do here at Sankofa is we do these nutrition classes. So we're trying to improve the health and increase knowledge of the residents, or anyone who participates in these classes. So we do the Prevent Type 2. We finished our first cohort last December, and we are in our second cohort now. We're about a quarter of the way through, and it's going pretty well. And I'm hoping to start a third cohort in the summertime when we can all meet in groups again. So we're doing that program, and we also include a cooking activity with our Prevent Type 2 diabetes. So we'll have the lesson for the first hour, and then we'll do a half hour, 45-minute cooking activity where we'll take a theme or an idea from the lesson and incorporate it into the cooking activity. So if the lesson is about like taking in fewer calories, for example, we did this last week, the cooking activity was to make a rainbow salad that was like super low in calories, but super nutrient dense with lots of fiber and colorful vegetables, to kind of enforce the idea, like, we can have lower calorie foods that are colorful and filling. And another program that we were doing the American Heart Association and Powerful Life curriculum. And we kind of labeled that Healthy Heartbeats, and that ran for a bunch of years. And again, it included a cooking activity on cooking with less sodium, using herbs and spices, ways to flavor foods with less sodium. But recently we've decided to switch to a different curriculum called With Every Heartbeat is Life. And that's put out by the National Heart, Blood, Lung Institute. And it's a curriculum that is specific to African Americans. So the materials, the cooking activities, the stories are more relevant, culturally appropriate to the Afro-American population. So that's just started. It's a little slow going. It's a little hard to kind of recruit folks during a pandemic, but we keep pressing on with it. And that's a curriculum that I'm excited to kind of roll out. It's been updated recently too, so it has all kinds of updated statistics and stuff about heart disease risk, etc. So next slide rather. Yes, so some other activities we do, we have outreach events here at the center. We have this big deck on the side of our building. And we run these twice a month. We have a themed activity or a theme for that monthly education. So for example, in February, it was American Heart Month. So we had blood pressure checks. So in the top photo, one of our community health ambassadors, she's a retired nurse. She's doing a blood pressure check. So we have that activity. We have food that we prepare, little things that we can give away, information, recipes related to that theme. We do this during pantry hours, so that's like our highest traffic areas. And we have community health ambassadors, ladies from the neighborhood who have grown up there, or leaders within the community who facilitate these classes. They run these activities and they promote our activities to the neighborhood. Next slide. Okay, yes, so partnerships. So obviously Second Harvest Food Bank, we're their community partner, Catholic Charities for the senior boxes. We also get some produce from Grow That Youth Farm. Culturate NOLA has donated stuff to us. So lots of big and small organizations are our partners. Xavier University, they help us with doing A1C, like all that sort of clinical stuff during our classes. The Main Street Project, I will mention in a little bit. Association of Black Cardiologists are the ones who support us for our heart health programs, and our city council, they help us with promoting our programs. But we have tons more, but these are the ones that I deal with immediately. Next slide. In terms of collaboration, so Xavier University, in addition to helping us with some of the clinical stuff for our classes, we are embarking on this COVID response task force to encourage folks to go get their vaccines. They got a grant from Blue Cross that they are entrusting us to use to promote COVID vaccination education. So we are putting together a sort of coalition or collaboration of community leaders to come up with strategies and ways and activities and ways to educate the residents here about COVID, the vaccine safety, and about the vaccination, where to get it, who's eligible, etc. Okay, and so another point with Xavier, that the funding that we're getting from them, once COVID sort of has subsided, the rest of the funding that we're getting from Xavier, they want us to use towards addressing the underlying health conditions and disparities in health, so that this at-risk population is better prepared for illnesses and viruses. So even when COVID is gone, we're still going to be working with Xavier to help address the health disparities in the area. Okay. Sorry. Okay, so the other part of what we do at Sankofa, so we're trying to improve the entire community. So that's the health and that's also the environment. So we have a wetland park. We have about 40 acres of land that the city has entrusted to us to how do I describe it? To renovate, I guess, to restore it to its natural habitat. There's a lot of invasive species, plant species in there, so we're removing those, and we are planting more native species. We want to have a space that kids can come and learn from, that people can come and relax. We have a few hiking trails. We want the birds and the wild animals to come back. So it's a space that will help in terms of like hurricane mitigation and flood mitigation, but also be a space to promote health and wellness for the neighborhood. Next slide. We also have a couple of gardens that we run. One is a growing garden that we will grow product to put in our pantry boxes. Another garden is for the neighbors, for the neighborhood to take a little space and grow their own foods, or just a place for them to come volunteer. We have a pollinator garden, get the bees and the butterflies to come out. So that's just a way we're trying to just beautify and provide greener spaces in the neighborhood. And finally, so Sankofa has this little outdoor structure where we had an outdoor market open twice a week. That hasn't run because of COVID, and it is actually going to be converted into this permanent space. So on the right, you can see this rendering of a building that we are hoping to break ground in May to have our market space in there, plus a teaching kitchen, which I am super excited about. So we'll have like a beautiful space where we can have our classes, do cooking demos. And we want to be able to expand these kinds of classes to the community, to include kids and families, and have all kinds of cooking activities in the building, and have it kind of be like this little hub for health, fresh foods, and wellness. And behind the building, there's a little parking lot, but there's also a green space there that we want to have a rain garden or some sort of garden space to grow product, and to also to teach kids about growing food. So that's under construction. Maybe in a year I can give an update, but that's what I got. Next slide. That's my information there. Thanks. And I guess we have some time for questions.
Yes, we do. Thank you, Ellen, for sharing all that information. So exciting. But I also wanted to just thank all three of our speakers again for just showing us more about all of your wonderful programs, all the work that you're doing to improve health disparities through healthy eating, food access, the community gardens, different wellness programs in our state that y'all are all doing, and especially sharing this information with our stakeholders and partners during National Nutrition Month. So I'm very excited that you were able to share all of that information today with us. So we will now open the floor for questions. I think we do have a few questions already in the Q&A. I'm going to go to the first questions. I think, Kira, it looks like you addressed some of them, but I just wanted to read them out loud. So one question was, what are some barriers that you have had to overcome to get participants to commit to the program? And Kira said, we were still working to overcome barriers. Motivation's the biggest, and then often referrals come, but the patient is not ready to make changes is one thing with referrals. So I don't know if you wanted to add anything else, Kira, for that.
Yeah, motivation would be a number one, but also, transportation, culture, kind of a normalcy of obesity, normalcy of, how we eat in the South, is definitely a barrier, and not willing to exercise is another big one. So baby steps is what we work through every session usually, but the biggest thing to get them to commit is that they were referred before they were even ready to say yes.
Great. And then second question, how are you finding participants? Is it solely from referrals? And you said, yes, definitely mostly from referrals. Some wellness centers also help to promote the program and help members to fill out referral forms and then send them to the participant's doctor also for signature to get more referrals. Yep. And then also your program, Kira, sounds great. Since there's no cost for participants, I was wondering in how you actually fund your program. And you said that you are a grant-based program fully funded by the Rapides Foundation. I think that was all of those specific questions for you. And then I think we have a few more coming in. So Quinn asked, how many patients in their respective areas do these various programs serve? So that sounds like that could be a question for all three of you. So I don't know if anybody wants to.
Yeah, we've had over 3,000 come into the program with at least an initial dietitian session to get started.
Okay.
This is Jordan here with MLK. We have about 1,600 unduplicated patients that get services. 94% of our patients have hypertension or some sort of cardiovascular issue. 30% of our patients are diabetic, but 80% of our diabetics have comorbidities, including hypertension. We have about 300 women who participate in Women's Health Program every year. DSME, the diabetes education class, we have about 4 to 6 participants every month. It's a monthly class. And then the DPP class we just launched, we had 10 participants.
Okay, so for the food pantry, we're at about 400 households per month. So that's about 1,000 people when you consider the number of people in the households. In terms of our classes, the DPP, this cohort, we have, I think, 11 or 12 participants, some in person, and a few of them are doing it through Zoom simultaneously. In terms of our healthy heartbeats classes, they were running before I got here. I've only been in this job since last May, but they used to have classes in like 5 or 6 different locations around the lower ninth and beyond the lower ninth ward, where they'd have like 8 to 10 participants in each class. So maybe 40 or 50 at a time.
Thank y'all for both all sharing. Helen, there's another question for you. Do you have a staff who delivers, or is it volunteer based for the delivery?
Yeah, the deliveries are volunteer based. We couldn't do it without volunteers. It's been harder more recently because as people get vaccinated, as things open up, our volunteers have been going back to work. So at the beginning of the pandemic, we had lots of people volunteering in the pantry to help pack boxes and make deliveries, and then it's sort of it's gone down a bit, but we have enough to keep going for now.
Great. One other question for you. Internet access is a huge barrier to many residents in rural areas. How do you get information about your program out into the community?
We do lots of flyers in our pantry boxes, since we reach 400 families, households a month. We do it that way. We have community partners in the area that we can send flyers or email flyers or drop off flyers, and then they can hand them out to people in their areas. We also have, we do email blasts, which I find a little challenging because a lot of our participants aren't really on email or social. They don't really check our social media. So the next thing we're going to explore is text blasting. So, signing up for a text blast program where you can, in that little box, get your message out there about an activity or an event or a program that's happening. Great. Yeah.
Awesome, thanks. And then this is a question also for all 3 of you. I think we addressed it a little bit with Kira. So Taffy asked, how are these programs being funded? So I know, Kira, you said all of yours are grant funded. And then so Helen, Jordan, I believe a lot of things, same for y'all, but I will let y'all add to that.
Sure, this is Jordan. So we are privately funded, so we receive no state or federal dollars to fund our programs. We have a number of local foundations that support us over the years, and then we also have a pretty significant donor base that has been consistently giving over the years.
Yep, we are mostly grant funded, so anything from like the Kellogg Foundation, AstraZeneca. I got a grant from No Kid Hungry. So yeah, we're really dependent on grants. We also participate in like donor-driven activities in the New Orleans area, like Give NOLA Day or Giving Tuesday, things like that, and just having donation buttons all over our website.
Great. And Kira, if you have anything else to add too about your grants and funding, you can do that as well.
Yeah, we're fully funded by the Rapides Foundation through a grant every year.
All right, I think that's it for questions. Kim Elson said, great presentation, terrific work. So thank you all for what you do to help improve the health of our Louisiana residents. So if there are not any other questions, I will hand it back to Marcy to close us out.
Yes, thank you all. That was some really great information. I love that you shared all the great work you're doing. It's amazing. So thank you. Just some closing notes. We will be emailing meeting notes with a recording of today's meeting. It'll include the registration information regarding, the trainings and meetings that we presented earlier. Also, if you have any questions regarding the collaborative or information presented today, please direct your email to this email address, laobesitycommission@la.gov. And if you'd like to stay in the loop with information about provider resources, opportunities, and upcoming trainings, please join Well Ahead Louisiana's Provider Education Network. So when you join, you'll receive a twice monthly newsletter with updates on for providers and their facilities about trainings, tools, resources, fundings, lots of opportunities. So visit the website at www.walpen.org and join there. And as I look forward, work groups will be scheduling meetings to be held in April and May. So if you're not already part of a work group, there's still time to reach out to the chairperson, which we'll share in the meeting follow-up notes. And our next quarterly meeting will take place in June. So we hope to see you all there. All right, I want to thank you all again for joining us today and investing your time to learn about how a few of our community partners are addressing these health disparities and seeing the amazing work that's going on throughout our state. So just one last thank you to our panelists, Helen, Jordan, and Kira. Such a great job. And we really appreciate all of you continuing to support and participate in Louisiana Obesity and Diabetes Collaborative, and look forward to seeing you again in June. Thank you all. Have a great day.